where you're positioning your patient, your line of force, direction of force, all of that's going to depend on which of the two fibers we're asking you to test. If you pull this one on the practical, again, if it doesn't specifically say MMT of the sternal fibers or MMT of the clavicular fibers, we expect you to do both. Does that make sense? Okay. Can I please ask you to take off your shirt and lay face up? Doing okay there?
Yeah.
Okay, so same thing, patient position, draping, that's all part of those easy points. So just going through the checklist, this is what I've been asking you guys to pull up during your practice time, because these things like explanation of tests, that's 1 point, but if you forget to explain the test for all 4, you're going to automatically miss 4 points. So don't lose those easy points, right? So I'm going to explain to my patient today, hi, my name is Dr. Lehner. Today I'm going to be doing a manual muscle test of your pec muscle. That's the muscle that's in the front of your chest. It's just going to tell me how strong it is. Is that okay with you?
Yep.
Something quick and simple. You don't need to worry about like all the finer details, but just something, explanation test. Correct muscle is tested. So if we're asking you to do specifically pec major clavicular fibers and you do sternal fibers, you would fail because that is the wrong muscle tested, right? So that's one of your automatic passes and fails. Same with your MLT, the extremity, your goni, and your MLT, there's a pass fail. Extremity is moved through the correct range of motion. So make note of those pass fail items because those are each worth a point, but automatic fails if you get them wrong. Correct patient position, patient draped. I have them laying on their back for this because we're going to be working against gravity with MMTs. We're going to determine passive range of motion. So we'll get to this where you're going to show your patient the motion you want them to do. You say, patient, this is what I'm going to want you to do with your arm. Can you please repeat that for me? Active range of motion, they do that with them, do that for themselves. Proper instructions and commands, just generally how you're talking to them. If you're telling them, I want you to tap your head, and they start doing that, you're like, no, that's not what I want. So how are you instructing your patient, kind of? Stabilization, so when you get into performing the test, making sure that you have a stabilizing arm. Your lever arm, location of pressure, what I was talking about, body mechanics, and we were touching on this a little bit last weekend when we were talking about the, was it the lat MMT we started with? Where I had mentioned that Dr. Parker